Okay, so to give an IM injection, we're going to first start by cleansing the spot where you're going to give it, but you're going to start at the acromion process. It's right here. You're going to go 2 finger lengths down, so you can feel it right there. It's 2 finger lengths here. So we're going to give it like a right in about this section here. I'm going to start in the middle and make circular motions outward. And then I'm going to let that dry. We are going to give this injection IM, so we are going to use the 25 gauge right here, and it's a 1-inch needle. Giving an IM injection, we're going to use Z-tracking. It's actually used on every spot on the body now. It creates a zigzag path through the tissue, and it's going to seal the needle track to avoid tracking the medication so that it stays in the muscle and doesn't go into the surrounding tissue. So to do that, we're going to take our non-dominant hand. I'm just getting the needle ready. I'm going to take my non-dominant hand. I'm going to pull the skin over. I'm going to keep that hand there. This hand is also here to stabilize the needle when the needle goes in. So here's the injection. If I were to actually give this injection to the patient, I would then place the needle here, hold it with my forefinger and my thumb to stabilize it. With one hand, I would push the medication into the patient's arm. I would then hold the needle there for an extra 10 seconds, allowing any medication to get into the muscle completely. Then I would swiftly take it out, put the safety cap on there, place this in the sharps container, and the patient should not have any bleeding, but if they do, you would then take a piece of gauze and you could just cover that spot. I'll show you what a sub-Q injection would look like. It's also going to be the same 25 gauge needle. It's going to be the 5/8 length. You see it done in the tummy, and today I'm going to do it on the fatty part of the back of the arm. So this area here, I'm going to pull it. This little area back here is where we're going to put it. I'm going to do the same thing. The needle is ready to go. I'm going to take my alcohol swab. I'm going to clean that area. This time, with the IM injection, you go to 90-degree. And with the sub-Q, we're going to go at a 45-degree angle. So I have that little area there. It's dried. I'm going to take the needle here. I'm going to hold it like a dart. I'm going to place it on the patient with one hand, inject the medication, pull out, safety cap on. I'm going to put that in the sharps container as well, and the patient should be all set. You never rub the injection site on an IM, and you never rub heparin or insulin.